Welcome to another Facebook Live with Veterinary Referral Center of Central Oregon. I'm Jen Bentley. I'm one of the doctors here at the hospital. I specialize in dermatology, and today we're going to be talking about basically why your vet is asking you to get blood work before a sedation, anesthetic event, or surgery. So I'm here with a special guest. This is Dr. Dujowich. Most people will call him Dr. Dujowich, which is a little bit easier to say. If you want to introduce yourself, give us a little bit of background on your education.
Yeah, sure. Hi guys. I'm excited to be here. So my education, I went to, where did I go? University of California, Davis for veterinary school. Spent 4 wonderful years there. Before that, I did my undergrad at University of California, San Diego. And then I did a couple rotating internships, which were each a year long. One of them was, one rotating internship and one surgical internship. And after that, I went ahead and did a surgical residency, which was 3 years long. So I feel like I just barely started working because I've been in school most of my life.
That's a lot of education. How many years total actually is that after
you're going to make me count?
Yes, I am.
I'm not going to be able to answer that. So 5 additional years, right? 5 additional years of training after 4 years to become a veterinarian. Yeah.
Awesome. All right.
So kind of a lot. Yeah.
Well, definitely we have the right person to discuss this topic. And if you guys have anybody else you know that would want to join the discussion on what we call preoperative blood work, make sure you share the link to the video. But with that said, we are taking live questions from you guys, and Shelby, who is manning the camera right now, she will be feeding those to us. And I'll just get started with the basic question: what is blood work? What are you looking at, and why do you run it before these procedures?
Yeah, perfect question, and I'll do my best to try and answer it. There are many reasons why we try to run it, but the overall arching reason is to make sure that the pets are safe to anesthetize. And there's different times, different circumstances where we might run, one thing or another. But for the most part, I think most people are familiar with hearing, if you've been to your vet and gotten a health check, you might hear them throw out a word called CBC, or it's not really a word, it's just 3 letters, CBC. And that stands for complete blood count. And then you might hear them throw out the word chemistry panel. Or if you've been to the doctor, they might throw that out too. And so those are basically 2 different blood panels that we use to assess the general overall health, internal health of the pet. And there's a few things that we're looking for, and I can jump into those now.
Yeah, why don't you go ahead?
All right, perfect. So on the white blood cell, or the CBC side of things, we look at the white blood cell count, and that's when we look at the blood specifically for how many neutrophils there are, how many eosinophils, is there a stress leukogram? Those are all big words that mean a lot to us, but basically you probably have no idea what I'm talking about, but basically what that tells us is there potentially an infection going on? And is your dog anemic? Does your dog have enough platelets before we go to surgery? And the reason that's important is the last thing I want to do is surgery on a dog where if I add the stress of surgery, I'm going to put them over the edge and they're going to decompensate and potentially develop a full-blown infection. Or I am going to go to surgery and let's say we have 40,000 platelets, less than 40,000 platelets. A normal dog should have probably at least 200,000, 300,000, 400,000 platelets. If we have less than 40,000 platelets and I'm going in there and hacking away, we might get bleeding, and we will get bleeding. We're going to get a ton of bleeding, and it might not stop.
Right.
And there's actually some breeds out there that are also predisposed to having bleeding disorders.
Dobermans, right?
Dobermans, yes, exactly. And that actually is a platelet dysfunction problem more than not enough platelets. So there's many reasons why we want to sort of dot our I's, check our, cross our T's, and check our blood work. On the chemistry side of things, I am looking at things like how's the liver functioning? How are the kidneys functioning? Those are the electrolytes normal? Those are really important to know before I go into surgery, because I'm going to be giving anesthetics, and anesthetics can cause unwanted side effects like lower the blood pressure. And I'm thinking of the kidneys in particular right now. Kidneys are happy they have blood flowing through them. If they don't have blood flowing through them, they're gonna stop working. And so if I go into surgery knowing that these kidneys are abnormal, I can take extra precautions. I might even say, hey, I actually don't want to do the surgery until I have somebody help me get these values back to normal, because it's going to be a pretty high risk if we have a drop in blood pressure and the insult that could mean on the kidneys.
Right. So some pretty important things about overall health and organ function that we're looking for on blood work to make sure we have a stable candidate for the surgery, basically. Again, we are taking questions from the audience. If you guys have any questions, that was a lot of information that Dr. Dujowich just said, so please feel free to chime in and ask us. If you're just joining us, we're talking about preoperative blood work. I think we've all been there with our dogs where they're like, hey, we need blood work before we do this, and why are they asking for that? One thing that I have heard people doing is not only preoperative blood work, but actually like preoperative chest x-rays. Is that something you do or recommend?
Yeah, not all the time, to be honest with you. It's a big balancing act. I don't want to do more diagnostics. So let me back up. All this costs a lot of money,
yes.
Right? And it's not inexpensive, and we don't have although pet insurance is more and more common in the veterinary field, and that has been really nice from the standpoint that we can do more than we were able to before. Our hands aren't necessarily as tied from hey, I want to do every diagnostic and look underneath every rock so I know exactly what I'm getting into. But the reality is a lot of people have to pay for this, and it's expensive. It's really, really expensive. And so if I don't need to do a test, I don't want to do a test. But so for example, if I have a young puppy that's super healthy and doing great, I'm probably not going to take chest x-rays before I do his castration, for example. But on the flip side, if I have, a 14-year-old German Shepherd that has, a bad knee and potentially other conditions, I might say, hey, let's shoot a chest x-ray, because unfortunately, when dogs get older, they tend to get cancers, and the most common spot cancer can show up is in the lungs. And the last thing I want to do is do a very expensive surgery, on a dog that potentially has, a very, very limited amount of time left with us.
Right.
So those are the reasons I might take x-rays. Another reason would be if I have a dog that's at very high risk for pneumonia. Those guys all recommend a set of chest x-rays, so we have a good baseline to see what the chest looks like before, and then if something's looking a little bit awry after surgery, we have something to compare against so that we know, okay, we're doing good, we're not doing good.
Right.
This is where we started.
Yeah, that makes a lot of sense. Is there any reason where you would be in a situation where you would say, hey, we don't need any blood work at all, let's just go straight to the procedure?
So, yes, if the dog is actively trying to die.
Okay, that would be a good reason not to slow down and get
that would
your
be a
blood
good
work.
reason not to slow down,
Yes.
which fortunately doesn't happen too often, but we do run into those situations. Other situations where I will sometimes say, hey, maybe I won't do a complete blood work, so is really young, healthy dogs,
Okay.
Where I might say, all right, let's just get the minimum stuff. So we might get a protein value, might get the hematocrit and maybe a glucose, and say, all right, call it good, and that's okay. Side story, I actually had surgery done on me, and they didn't do blood work on me, and it
so
felt
crazy.
And as a veterinarian, I was thinking,
Yeah.
oh my gosh, shouldn't you do blood work? And the nurse is like, well, do you think something's wrong with you? And I'm like, well, no, I don't think something's wrong. And I tore my ACL, that's why I had surgery, and they never did blood work on me because I was otherwise healthy.
But it's interesting because they can ask you, do you think something is wrong with you? It's
That's
like
exactly
I can't
what I was
ask the
gonna
dogs
say.
that.
Yeah, that's exactly what I was going to say. Is like I can't ask the dog. Do you have stomach aches? Do you have any other problems?
Yeah.
And so that's another reason where we potentially maybe do blood work more often than our human counterparts,
Right.
Because we just can't get all the information unless we get a needle,
Yeah,
and take some blood.
I can say I do blood work sometimes before I put patients on long-term medication, and I am often surprised with some of the abnormalities that dogs will show on their blood work, which the owners haven't picked up on. And that's not to say that we're not looking. It's just they're animals and they're so stoic and they're so good at hiding things.
Yeah, and one thing to follow up on is, yeah, sometimes I'll get totally surprised and find stuff on blood work that I wasn't expecting. On the flip side, there's also a lot of things that even despite doing blood work, we'll never know, you know?
Yes.
And so blood work, so for example, it is still possible to have an infection somewhere, like an abscess, and the blood work be completely normal. So even though the blood work is very, very helpful, sometimes unfortunately it's not helpful at all.
Yeah, it's true. You know, we are limited by the diagnostic capabilities of these things, and it gives you kind of that broad overview, but certainly not the whole picture for any type of disease process. Well, I think that kind of wraps it up for us. Feel free to let us know if you have any additional questions after watching this video, and we'll be happy to answer those. Tune in. We will be here every other Wednesday for another Facebook Live event at 4 o'clock. Yeah, let us know what you want to hear about. If you like the video, give us a big thumbs up for it, and we'll be happy to answer any comments or questions you guys have.